Hey, Dr. Tyler Williams at Better Sleep SLC, and you're here because you have some questions on a snore appliance or a dental sleep apnea appliance and how they work and maybe some of the differences. So I'll give you kind of three main categories that we put these into, all right? And we'll kind of walk through the pros and cons of each. But essentially, we're sharing with you is how to go from something that just covers snoring all the way up to a long-term plan to treat your sleep apnea. So the first of the three are going to be a snoring appliance or a snoring mouthpiece. These you can buy online, or you may have tried one over the counter or something you boil and bite. And about 90% of people who get these stop using them, or they only use them temporarily. Now, they can be good if, for example, we have some patients that we're doing expansion on their mouth. Okay, so it's a type of orthodontic treatment that's geared towards sleep apnea treatment, or it can be also called epigenetic appliance therapy, where we're actually taking your teeth or your mouth areas that are crowded or too narrow and expanding those, which also gives you a nice full smile, but it gives your tongue more room so you can breathe better and sleep better and get more air in, which has been proven to be effective in enhancing your sleep apnea treatment. So in that case, we do have some select patients where we're using some type of transitional appliance, but just know that most of the ones you buy over the counter online, they may be approved for snoring, but they're not going to be FDA approved for treating sleep apnea, because sleep apnea is a medical disease, and that would be similar to buying something over the counter to treat your high blood pressure, when really it has to be diagnosed and treated and ordered from a medical professional. And it's the same way with the sleep appliance, right? So that's kind of your first category. Is they might help some people with snoring, they may not, but they're not designed for treating sleep apnea. Now, your second one is going to be kind of your average dental appliance that you could get from some dentists who make sleep appliances. And I did this for many years, right? Which is, I would make an appliance and then we would send you back to your physician, and fingers crossed, hope it worked, hope your numbers improved, hope it was comfortable, hope you didn't develop jaw problems, hope your snoring improved, right? And, it was probably 50-50. Some people said, hey, this works great. Others said, well, I don't know if it worked, or the physician would say the numbers didn't get where we want to be. You got to go back to CPAP or maybe look at surgery, right? So that's because in dental school, we're trained on making mouthpieces. And when I did my training, we learned a lot about mouth guards and how to get good impressions or scans of teeth. But incorporating the medical piece into it just isn't part of that training. So that's where part 3 comes in. Part 3 is, or the third option is, working with a dentist that's trained both in the dental aspect of your teeth, but also in the dental sleep medicine, which incorporates working with different types of sleep professionals, board-certified sleep specialists, different types of labs for different types of cases, having the equipment to follow up and retest you and making sure that things are working. Also having a bite matrix to be able to find the most comfortable and air-giving position for your jaw. So we've learned how to sort of tune your jaw or put your jaw and tongue in a better position so we can actually predict where you snore the most and work around that, or predict where you gasp the most or choke, don't get enough air, and be able to put your jaw in a more desirable position. And that's been a lot of fun for us because our success is much higher. Typically, we're about 85 to 90% successful with our sleep appliances. Now, it doesn't mean that you're a candidate or everyone's a candidate, because there is a screening process to go through. And it's important that you work with a sleep team, not just, buy one device online or go to one dentist you heard can make mouth guards without doing the proper workup, right? Just like any type of medical treatment, you want to make sure that you get proper x-rays and documentation and testing and sleeping, and then follow-up built in as well. So Thanks for taking a minute to watch this video. If you have some more questions on different types of devices or appliances, please watch our other videos. You can also call or text us at the contact information below, and we look forward to seeing you on the next one. Have a wonderful day. Thanks.